Welcome to Sweet Life Beat Life. We hope this video helps.
You'll begin by selecting a firm, supportive pregnancy pillow and cleaning its cover so it's fresh against skin. Once done, lie on your left side. This position improves circulation for you and baby. Place the pillow between your knees to align hips and spine, then tuck a small wedge or rolled towel under your belly for lift. These first steps reduce pressure on your lower back and make it easier to breathe. Keep movements slow and deliberate as you settle in. Now focus on fine-tuning. Raise or lower the pillow under your head until your neck is neutral. Try about 1-2 inches higher than usual if your belly tilts your torso. Once done, tuck the pillow behind your back to create a gentle barrier that keeps you from rolling onto your back. If hips still ache, place a small pillow under the top knee for cushioning. Make sure to move slowly when changing positions to avoid strain. These adjustments optimize spinal alignment and comfort. Finish by testing how long you can comfortably stay in the setup. Practice getting up by rolling toward your knees and pushing up with your arms to avoid twisting. Once comfortable, note how the pillow doubles for postpartum feeding support. If the pillow becomes lumpy or loses shape, replace it. Aim to assess support every 6-12 months. If you feel worsening numbness, pins and needles, or severe pain, stop using the pillow and contact your health provider promptly. That's the single best troubleshooting.
Thanks for watching. Consider subscribing if we helped you.